Hello and welcome back for another episode of Ask Kate, brought to you by the Children's Tumor Foundation, where I, Kate, answer questions from the NF community. Today we're going to talk a little bit about clinical trials. So when you're living with NF and you know that currently there is no cure for the 3 different types of neurofibromatosis, we have a long way to go in our understanding of the condition and how we can best find that cure and improve the quality of life for people who are living with NF while they're waiting for that cure. So a clinical trial is a specific type of research study where an intervention is given to participants and then the response of subjects is assessed. So that's a fancy way of saying that people who sign up for the clinical trial are going to be given some kind of treatment. This could be a surgery, a medication, a psychological intervention like a certain type of therapy, and then they're followed in different ways to see if that intervention is having the effect or the impact on their health, medical condition, quality of life that the researchers were hoping for. So participating in a clinical trial is a decision that you have to make as an individual, hopefully with the help of a supportive and trusted healthcare provider. So there are a few reasons that you might consider getting involved in a clinical trial. The first would be personal benefits. So this is the fact that if you get involved in a trial and the treatment is effective, there will be obviously direct personal benefit to either your medical condition, your overall health, your quality of life, and this is obviously of great benefit to you as the patient. Also, you can consider community benefits. So clinical trials can help provide the NF community with more information about how NF is affecting people differently and why certain treatments don't work or do work. And third, clinical trials are all about helping us find doing better research. So even when a clinical trial doesn't work, which can often be very disheartening news for the community when we find out that a drug we were excited about maybe isn't having the effect that we had hoped for. But even in those cases, this failed research is going to guide the direction of research in the future. It's going to give scientists more and better information on how to focus future research, which is incredibly valuable. So considering that, you might think, well, how would I get involved, or how would I know anything about what's happening with clinical trials? So there are a few ways that you can do that. The first and most important one that I always say this is the first stop to make is with your healthcare provider. So whoever is providing kind of your main NF care, whether that's a primary care doctor, a neurologist, a medical geneticist, it can look different for different people. But start there. Talk to your doctor and say, what do you know about clinical trials? Is there something that might be appropriate for me or beneficial to me in some way? And that's always the best place to start and to kind of learn together with your provider what's available. In addition to that, if you go to the NF Registry website, up at the top of the screen, there's a little white words that say clinical trials, and you can click that, and there's a complete listing there of current clinical trials that are running that impact the NF community in different ways. So you can read more about them, and then each of those descriptions has a hyperlink to the third place you can check, which is clinicaltrials.gov, G-O-V. And so this is just a website that the U.S. government keeps of all clinical trials, and it's a database that you can search. And so these two options, both the registry and the clinical trials website, are really fantastic resources. But I always caution patients that the information can be incredibly overwhelming. It's not designed for the patient. It's really, particularly the clinical trials website, it's really designed for the researcher. And so even the way things are described can be overwhelming and confusing. So if you were to look there, I would still say take that information back to your doctor to discuss, what does this mean, and is this appropriate for me or for my child? Also on the clinical trials website, there's contact information for the folks that are running each of those research projects. So you can get in touch with them, but I always want to caution families to start first with your own healthcare providers before you start trying to contact researchers about what they're doing, just because that can get complicated and overwhelming and isn't always the most effective use of your time. So also, the other thing I really want to say, and I know we talked about the registry in another video, but being a part of the registry can really help, is also a way of being involved in research. So the registry itself is considered NF research, It's not a clinical trial. Obviously, we're not, administering that intervention we talked about earlier. But when you're a part of the registry, researchers contact the Children's Tumor Foundation and they say, we want to do research on, as an example, adults with NF1 and chronic pain. And so then that researcher would tell us that. They have to present their entire plan for what kind of research they're going to be doing. And then certain people at CTF approve that researcher, who then is able to send a blind email to any person registered with the NF registry who has given their permission, because that's part of signing up, is that you give permission to receive these emails. And you get an email from them saying, this is who I am and this is the research I'm doing and I'd love to include you in that. Now, until you choose to respond to that email, they don't know who you are or anything about you. So your information is always protected in that way. But again, being a part of the registry does mean that you may get contacted in these ways, which gives you opportunities to get involved in research, which can be a really fantastic thing. So the Children's Tumor Foundation is really dedicated to driving research forward toward effective treatments and, again, eventually a cure that will end NF. And as someone that is living with or caring for someone with NF, or who yourself has NF, you are an essential part of that drive. You are an essential part of that process. And so I hope that you'll consider learning more about clinical trials. And of course, as always, get in touch with me if you have any questions about anything I've said today. Thanks so much, guys.